So it's a wonderful time here. It's another opportunity to learn something new, something good, something fresh. As you can all see, I have one beautiful lady with me, and you would you would want to know who she is, but I wouldn't go too much. I'm not talking today. She's going to do all the education. So we can see one beautiful lady. Can you tell us your name and what you do, where you are? Let's know something about you.
It's always so strange to talk about myself, but
Okay.
my name is Alice, so you all can call me Alice. That's fine.
Okay.
Soon to be Dr. Alice. Hopefully next week.
Oh,
Hopefully next week by this time I will be Dr.
wow.
Alice.
Someone blew, some whispers of, one or two words into my ear. So I asked you about the research topic, if you remember.
Oh,
Yeah,
yeah. I
someone.
can't talk about it because I haven't. It's not out yet. But
Okay, sure.
hopefully after next week I can talk about it.
Ooh, let's see how it's going. Like, the ladies are, you are making us proud. You're making us proud. Yeah. All
Yeah.
right.
So,
Mm-hmm.
Alice, I go by Alice. That's fine. I am based in the States. I am a licensed mental health counselor. So my area of expertise is trauma. I'm also a researcher as well, a PhD student, all of these things. I use EMDR specifically to help people process trauma. So that's why I talk about EMDR and trauma a lot because
Okay.
when it comes to therapy, that's my focus with what I do.
Yeah.
Really, I'm also on social media. I talk a lot about um, African women, our lives, our mental health, how we can improve ourselves, breaking generational trauma, kind of just, living life on our
Wow.
terms as African women.
Living life. Okay, so that's such a wonderful, introduction. It seemed like you just scratched the surface to us. We will take it like that because we are just yet to, dissect into your brain and to get whatever you've been researching on, whatever you've been, doing over the period. Okay, so
Yeah.
before when I contacted you, I think it's been a while now, right? And
Yeah.
then I told you I wanted to interview you because I've been following your TikTok for some time now, and I realize you take situations that happen across the globe, okay, not just Africa, which makes me like your content so much. You take everything at all and then you try to dissect them, make us understand why, example, anxiety is actually troubling us, how trauma is troubling us, how addictions and a whole lot of things. So I paid very close attention and then I'm like, okay, I need to that thing, grab you. I need to get in here. Yeah. So
Yeah. Yeah.
tell us, what have you been up to? I mean, with all the things going on, what have you been up to in recent times?
What have I? Oh, so in recent times,
Hmm.
let's see, what have I? So I made a big transition.
Okay.
I lost my job in a way, so made a
Oh,
big transition
sorry.
into um, being self-employed. So that's
Okay.
what I am trying right now to build a mental health startup, right? So
Okay.
really trying to build an ecosystem for Africans to see how um, I can support people either in Africa or here. So it's
Okay.
just a start. So
Okay.
hopefully using my research in all that I do
Uh-huh.
to first, support people one-on-one, support also organizations, churches that want to learn about mental health,
Hmm.
and then hopefully helping the professionals in Africa,
Okay.
helping them in terms of professional development and stuff like that. So that's the big vision or the big idea. So that's what's taken my time.
Okay.
And then School is kind of my priority, or has been my priority
All
since I
right.
transitioned out of full-time work. So that's what I've been really focused on,
Okay.
to get that out of the way so that I can move on to other things.
Other
So
things.
I
All
would
right.
say those two things have what I've been really taking my brain or
Your brain.
focus on
All right.
these days. Yeah.
Okay. So, in the first place, I reached out to you about the broad term addiction, right?
Yeah.
Yeah, and I wanted us to go deeper into addiction, and then, if possible, we talk about one very important thing, which is it's actually let me say is putting a lot of pressure on the youth as at now. We
Okay.
have specifically masturbation.
Okay.
Okay, but I mean, we will talk about addiction, and then if we get the time, we hit a little bit on masturbation. Is that okay with you?
Yeah.
All right.
That's fine.
So I prepared a lot of questions, a lot. I don't know how we are going to finish this, but anyway, let's get on, guys. Let's get on. And so, um, how would you define addiction, and what actually distinguishes it from other forms of substance use or behaviors? Yeah, yeah.
Yeah. So in terms of addiction and mental health, it has been a journey to where we are now, right? I'm in the US, so what I'm going to speak on will be from the context of the US and the
Okay.
work that has been done in the US, to the point in the US where we are now. Addiction is, we see it as a disease, right? A disease that affect your brain, your behavior, your thoughts, your emotions. So
Hmm.
that's what we see, is that even in the DSM-5, we are even moving away from addiction to talking about substance use disorder. So talking about it in terms of a disorder. So addiction, right? It's anything, or we can say any behavior that in a way you cannot do without, right? So you have become dependent on that thing, right? And so I
Wow.
said any behavior because anything can be addiction, right?
Okay.
However, in the world that we live in, if you look at the broader spectrum, some behaviors are okay, right? And some behaviors are not okay, right? So some sort of addiction is okay. You can be addicted to shopping. It's okay, right? It's not
Okay.
that frowned upon. You can be addicted to shopping. It's okay, right? I talked about that. You can be addicted to working out. Some people are
Okay.
actually addicted to exercise and working out all the time.
Yeah.
You can be addicted to plastic surgery. You can
Hmm.
be, so there are so many things that we can talk about. Sex. We can talk about gambling. We can talk about, we have the religious sort of addiction as well, where it's always prayer, 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 church,
Hmm.
church all the time. So
Okay.
any behavior, right, can
Okay.
be addictive, right?
Okay.
However,
So
I want to read something from the DSM-5,
go
to
on.
you,
Go on.
to kind of give you like um, a basic
Okay.
idea that we are talking about, right? So when we talk about addiction, it says that it involves the reinforcement of behavior and the production of memory. And so these behaviors, drugs or whatever, they really target or activate our reward system. And so that's what it really targets, or reward our reward system, so that normal activities may be neglected at the expense of that thing that the person is addicted to. So clinically, if we are going to diagnose somebody with addiction, it
Mm-hmm.
has to impact their day-to-day function, right? So it impacts their social life, it impacts their work, it impacts taking a bath, taking care of themselves. It could impact them financially before we get to where we would say um, this person is addicted to something. And because it also targets your reward system, we can also look at it as a neurological issue, right? That your dopamine or your reward system, it loses a thing that you are really chasing this thing, that you cannot think of other ways to get that reward, but it's that thing that you are addicted to. So it means you can do anything to get that thing. You can steal. We've heard of instances where people have drained their children's savings account. They've sold their homes. They've done things that maybe somebody who isn't addicted to anything will be like, why would you even do this, or why? What's there?
Mm-hmm. Mm-hmm.
What's it doesn't make
The
sense.
motive, yeah.
Yeah.
So you've actually mentioned a lot of things here, and I'm trying to break some of them into bits. Looking at, I think you've even gone further to talk about some of the complications like stealing, people draining their children bank or life savings, and etc. Some also has to do with the target reward system. And then where interests me the most, I'm a medical doctor, so all the time I try to put things into that kind of perspective. So from different forms of researches, we realize that certain activities, I think you mentioned quite a number of them, sex and shopping. I was excited about that. I know most of our ladies, they really like the shopping aspect. Yeah, they'll be like, come on, give me the money, let me take it to shopping, and I'm okay with
Yeah.
that. Yeah, so
Yeah.
shopping, people are addicted to the gym. Yeah, people are addicted to religious activities and all of those things. Yeah, but when it comes to the brain, all right,
Yeah.
I tend to understand that a lot of the things that goes on in the brain, this what happens. When you find yourself doing one activity, it settles, first of all, like the frontal lobe, which is like where your cognition is. So at every point in time, your cognition is interested in remembering those memories that are
Yeah.
interesting, they are happy memories. Right now, when as it proceeds, it gets settled, and then it looks like the limbic system also picks it up, and then every time it tends to remind you. You mentioned some hormones, the dopamine,
Yeah.
serotonin, etc. They come in and they're like, they've grabbed on it, and so they want
Yeah.
to feed on you every time. Now,
Yeah.
I have a question for you coming from these angles. Yes. So,
Yeah.
how specifically, okay, because you've been able to identify that this is what is actually happening to someone, and so the person is addicted to an activity. What are some of the common misconceptions people have about addiction that you have encountered in your turn of service, working, and etc.?
I think one of the biggest misconception is that people have control, and so they can stop whenever they want to.
You mean that's not it?
That's not it, right? And it's like, so we are talking about human behavior here,
All
right? So
right.
it's not
Yeah.
black and white, right?
Mhm.
We cannot negate. There are people who would say, "Oh, one day I woke up and I decided not to drink again,
Mhm.
and that was it," right? However, you as a doctor, you also know that alcoholism, if you are really addicted to alcohol, you cannot just wake up and say
You can't.
to
Yeah.
stop, right? Because detox and withdrawal in of itself, we've seen, like, you have to be in the hospital to be monitored, your heart rate, you have to be given fluids, people throwing up, people doing things like the withdrawal in of itself can kill
Itself.
you.
Yeah. Yeah.
And so that's why I think sometimes it's always we talk about do not get into it, because when you get into it, it becomes so difficult once you are addicted,
Yeah.
especially if we are talking about substances. Because the other thing that you talk about also, we as people, we forget that we are chemicals.
Okay.
like we are working around our biology, we are chemicals, and so if you take these chemicals and now you're like, okay, I want to stop. It's not that easy to say for
It's
you to.
difficult.
It
Yeah,
is very difficult. So that's what
it's
I
very
mean
difficult.
that once the brain comes into it, right, how you explain it, and the neuron pathways are
Mhm.
formed, you don't
Okay,
have control over it.
okay, okay.
It overtakes your life. It takes control over you. So it's not just a matter of willpower, right? The
Okay.
willpower comes in when you are not, when you haven't tried it yet, right? So that's why we are always telling people, do not
Get into it.
say, do not get into it, right? Do not even, and the other thing is also, there are studies that also talks about addiction also being genetic, right? It can be hereditary as well. So
Oh, wow.
if 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 your family, right?
Hmm.
If you know your family line that, and again in Africa we don't take it serious, but if you know that okay, addiction or alcoholism runs in my family, there are people that once they know that they
Touch
will
it.
not even try
Yeah.
alcohol or anything because they'll be like, it runs in my family, so I'm not even going to try it.
The tendency. Yeah.
Yes, yes, right.
Yeah.
And so we can also talk about that. So the willpower,
Hmm.
it's not just something that you can just say, oh, have control over it, right? Or control
Yeah.
yourself, or
Yeah.
abstain and all of that.
Yeah.
I think the other thing is also some people think that it's a white it's a white man's thing, right?
Okay.
That Africans, there is nothing like addiction in Africa. But I grew up in Ghana, right? And we have
Yeah.
people that would drink and they would be sleeping in gutters, and
Okay.
we will laugh, right? The village drunk, we just laugh at them. We play with them, or they
Hmm.
are saying, "Oh, Akawide," or "Your Korinsini,"
Yeah.
so those kind of things, right?
Yeah.
And so
Yeah.
we don't take it serious. We don't
Okay.
take it serious. Our very our, like our way of explaining everything, right? Either it's some devil that has cursed your family, and so your family, that's all that they do. It's that, so they will take you to church. They will do all these kinds of things, right? And so
Pray
that
for
also,
you.
yeah, that also
Okay.
becomes difficult. Oh, it's rich people. If you are poor, how can you have money to
Persistently do something.
right?
Yeah.
But like we talked about the reward system, right? If I am poor, right, and I want to escape, and there is a drug available
Mm-hmm.
to help me escape from the stress of life,
Mm.
that I can forget everything and be high, even if it's for a minute, I would like to escape it, escape my reality, and not be in that reality. So those are some of the ones that come to mind.
Okay.
For me.
All right.
Yeah.
So I listened to a TED talk on addiction, all right? And
Mm-hmm.
then this American presenter, he was
Yeah.
talking about how this country, Portugal, were able to handle addiction and handle it perfectly.
Okay.
I mean, getting to the latter part, I will bring when you are trying to let us know how to actually manage some of these things, I will just remind me to be able to put a more configurative analysis on that point, and then
Okay.
we get it. Yeah, so I want to know, how do you believe societal attitudes? I mean, you talked about back home where someone can drink, get drunk, and then be lying in the mud or something, and people will be laughing. So, how do you believe that the societal attitudes towards addiction impact individuals seeking help?
Mm-hmm.
People who are
Yeah.
seeking help, yeah.
Yeah. So first of all, people will not seek help.
Okay.
They
Oh,
will they will keep
okay.
silent, or because they don't want to be shamed.
Mm-hmm.
They don't. They will not seek help, and they would also see that okay, this is a personal failure on my part,
Mm-hmm.
right? So either I should pray or I should be able to control it, right?
So yeah, before you move on, do you think if, let's say, I'm addicted to a particular act like masturbation, do you think I will be able to tell myself that, okay, I'm not going to seek for help. I'm going to stop by myself. I'm going to stop. Do you think
Some people said they've done that and it's been possible, so I cannot say no.
so? There's a possibility.
Some people said, like I said, some people said they've done that.
Okay.
That they woke up one day,
Okay.
and we hear it even with alcohol, with cigarettes. We hear
Yeah.
people say, "Oh, I woke up one day and I was
Yeah.
like, this is the last day I'm not going to do it."
Yeah. Yeah.
Yeah. So
Okay. So
yeah.
yeah, it's there. I think sometimes, even in the consulting room, sometimes someone just comes in, you ask, okay, so do you have this medical, when you are taking the social history, do you have this? They said no. Okay, do you drink? No. Do you smoke? They said no. Okay, sometimes they'll tell you, okay, socially, or the
Yeah.
person will be like, oh, I've stopped.
Yeah.
Okay. And they said I've stopped, but when you try to find out the actual when, it's like, oh, just like 2 weeks ago, like, that kind of thing.
Yeah. Yeah. Yeah.
It's like,
Yeah.
oh, like 2 weeks ago. So, I mean, you are right to say some people have been able to do this and that and it's stopped and all of, yeah, that kind of thing. But anyway, so I will be going a little bit further into some either personal or general questions.
Okay.
Let me find out from you.
Yeah.
I have some friends, before this interview, I posted it on my WhatsApp that I'll be interviewing someone on some addictions. And I didn't quote that masturbation, but people started asking me a lot of questions. And then I'm like, I'll be putting some of them to you. So
Okay.
one of those questions that came was, am I normal if I've never masturbated before? Use me at my age. Am I
Yeah. Yeah.
normal? Yeah, am I normal to say
Yeah.
I've
Yeah.
not masturbated before?
You're very normal. Also, what is normal? Normal is very subjective, right? But you are
Okay.
normal. Masturbation isn't something that you have to do, so you are very normal. Yeah.
I'll 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 hit a little bit on that.
Okay.
So I have some colleagues, and then one day I wanted to talk about on my YouTube channel. I want to talk about some addictions, and then they were interested in getting to know what I wanted to talk about. And then I mentioned that masturbation,
Okay.
and I started asking on my WhatsApp pages, like, have you masturbated before? This person said, come on, what kind of question are you asking? I have. Have you done this before? I have. Have you masturbated? Have you done that? And they're all saying that yes, 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 yes. Then I'm like, okay, so I haven't done that before. And they all started like on the phone. This person is like, no, I don't believe you. I don't believe you've never masturbated. I don't believe. I'm like, I just can't get the whole thing to myself that I need to touch myself. I need to pull my private part and stuff like that in order to gain satisfaction. All right.
Okay. Okay.
But the reason why I was bringing this topic out is because post COVID, what happened was people are all stuck on their mobile phones.
Yeah.
It's difficult to go out, make friends, talk to people, like relation. Human beings are made in the form to relate to others. Currently, if you sit on a bus or wherever you are going, it's either you are picking an Uber, or I mean, you want everything personalized just for you so that you can concentrate on your phone. So dating apps and etc. Are becoming more of, it's just online relationship people are having.
Okay.
So sexually, people are not meeting together to do the normal thing we used to do back in the days, pre-COVID.
Okay.
So people are resorting to the cheapest means, that is pool and be free, pool and be free, or just, I mean, it's the cheapest way.
Okay.
Who buy some oil, do it in the room, buy some electric or something like that, kick yourself and electric. I don't know how to say whether you are electrocuting yourself or whatever. I mean, what is your take as an EMDR? What is your take as psychologist? What's your take on some of these things? Do they come to you? I mean,
Yeah. So it's not that um, it's not that simple, right? And I think when people come to me as a therapist or to talk to me, especially if it's trauma therapist, each
okay,
individual is different, right?
yeah,
So
yeah,
I have seen, I have done, I do, I have, there are some trauma therapy that
hmm,
I may actually tell people to masturbate or engage in themselves, or sometimes we call it self-exploration, right?
okay.
Um,
So you sometimes encourage it.
yes,
Okay,
yes,
okay.
yes.
Now it's getting more interesting. I love that. Let's go.
So and the way, and especially for women, right? I
Okay,
sometimes, like I put it, I think the term masturbation sometimes can be, it may have so many connotations to it. So like I said, self exploration, right? So if it's um if it's a woman who is having issues sexually, sometimes it would be like, okay, how can you tell somebody what you like if you don't know what you like, right? Do you even know
okay,
what your body looks like? Do you know how it looks like down there? Have you taken the time to really explore your own pleasure and explore your own sexuality so that you can communicate that to somebody, right? So that's one way. There are times that if people have self-image issues,
hmm,
that's what we are going to do. Stand in the mirror naked and look at your body and explore your body in that so that you are able to reconnect with yourself and build a relationship with yourself. So each person, right, is going to look different for each person. Now, if we are talking about it in terms of addiction, then we have to think about that, is this thing taking over the person's life, right? Is it stopping them from actually forming relationships with people? And if let's say they form relationships with people, do they get more pleasure sexually from that than getting pleasure with the other person? Then it is becoming in a way destructive, or it is becoming addictive in that it is the only way that they are getting that reward, or the only way that they are getting that pleasure. Are they leaving their desk at work to go to the bathroom every hour, every 5 minutes to do it? Those kind of things. So we have to, again, we have to look at each person individually. So if
okay,
you haven't, if somebody says, okay, I haven't masturbated before,
hmm,
right off the back, I'm not going to say, oh, that's so terrible, right? Okay,
okay,
let's talk about it.
okay,
First of all, do you think it's an issue? And if you think it's an issue, why do you think it's an issue? That's where we
okay.
are going to get from, right? Then we
Some
are going to,
answers.
then we
Okay,
are going to look at a little deeper. Growing up, maybe what are the messages that you heard about masturbation? And how is it impacting you, right? Do you think you are less than if you haven't masturbated before? And there are times that people haven't done it, not because they don't want to do it, but
hmm.
maybe because they don't want to go to hell. So
Oh,
it's not even,
the religious part of it.
yeah, yeah. So it's not
Okay,
like they haven't done it because, oh, I want to form more relationships with people, but they have the edge. They've been
hmm,
thinking about it.
okay.
But each time they think about it, they will pray it away, or they'll be like, oh, I'm not supposed to do that. Or bone and those kind of things. So
Then some of us are praying. some of us are praying that, oh God, please, no, we
Right?
can't do this.
So it's not that maybe they haven't done it and it's not on their mind, or they are carefree, they are not thinking about it. But you
Okay.
meet somebody who hasn't done it, but it's on their mind every day.
Hmm.
They are thinking about it.
Wow. I mean, you are taking me to a different, perspective, dimension of now. So how does someone get addicted to something like masturbation? How?
Like some of the things that I am saying, right? And
Uh-huh.
so addiction may not be, masturbation may not be the same as maybe you're drinking alcohol, right? Because
Yeah.
in drinking alcohol, we are adding a chemical. If you're taking other drugs, we are adding a chemical.
Okay.
However, it targets the same pleasure system.
Nervous. Okay.
Yeah,
All right.
yeah, the same pleasure system that we are talking about. So
Of
you
course.
have.
Yeah, sorry. Of course, if you do it and then you've pulled, you've applied the cream and stuff like that, everything drains. It's just like you are having the encounter with someone because you need. I don't know how it's done, but it looks like you need to picture someone. Okay, I don't know how it is like. Yeah, seriously, but it looks like you need to picture someone and then be
Okay.
able to assume that position, assume that state that you are actually
Okay.
having this with the person. I don't know, but if that is it, then it means you need to also have some form of picture about whoever you are picturing in order to be able to do that. And that is an excitation of the memory, yeah, whereby the hormones will also be released. The dopamine, the serotonins, they'll be released in order to excite your nerves to be able to do that. Right. Right. Okay. Okay. Yeah, I think I look. So someone asked me, so when you've not done it in months, you know, how do you feel without having anything to do with, let's say, either the opposite sex or whichever sexuality you find yourself in, or you've not pulled, you've not touched yourself, and etc. How do you do it? How do you go and have the whole kind of fun you feel? Is there any advantages to even masturbation? Is there any advantages?
Is there any advantage?
Yes.
So I think the advantage will be you get to know yourself,
Ooh.
right? You get to know yourself in that way, so that maybe when you meet somebody, you can explain to them, this is how I want you to do it, right?
Okay.
And so again, everything we have to look at it in context, right? And I'm
Okay.
sure you as a medical doctor, you've also, there are situations when it comes to people undergoing fertility treatment, there are situations that men have been told to do it so that their
Exactly. they
sperms
get
can be
they get the
expelled
sperm
out.
and be able
Yeah,
to do the insemination. All right, all
yeah.
right, okay. I think
So
you've got me to my own field. Guys,
so
that's why we need a psychologist. Oh
each
my god.
individual is going to be different, right?
Yeah,
And
yeah,
so again, I think also one thing is that sometimes the idea is that, oh, all boys do it. You know, boys at the age of,
yeah.
when they start the teenage puberty, they are getting to know themselves.
Uh-huh.
That thing, right? So they,
Okay.
in a way, they are exploring. And when we look at sexuality, right from infancy, kids are exploring themselves sexually, touching
Yeah,
themselves, all these kind of things. So
yeah.
again, it is culture and maybe religion that makes people feel bad, or that put it in that context that this is so
Okay.
wrong, or this is a taboo, or you're not supposed to do it. Now, if you're talking about addiction, then is this something that you feel like I have to do it every day, right? Or if I don't do it, something is going to happen to me, or I can't function. You are shaken. You know, it's like, oh, I need my fix. I need my fix. And even for some people, it's not just masturbation, but it's, sex with another person as well, right?
Okay.
And There are people that have to get it all the time. That
Yeah.
even if they are not with somebody, they would pay sex workers to get it. That they may even drain their bank account. They may not have money, but however it takes, they have to get it. Right.
Tell me, tell this one. Tell me the difference here. So,
Yeah.
addiction. Okay. Let's say I'm someone who loves to actually um I've never explored myself, but I know when it comes to the sex, I like it. I want to have more. I want to get
Okay.
a lot of I want to explore more with the person I'm in love with or with my partner. Yeah, but the point is, when I'm not getting it, I'm still okay. All right.
Okay.
When I'm not getting it, I'm okay. Between this, I feel at a point I'm addicted to it. At a point where I feel no, it's not an addiction because I'm not so keen about it. If I'm busy, let's say I'm concentrating on my exams, I have things on my table to do. I'm not really perturbed about it. So between the one part of me who if I don't get it, I'm okay. If I get it, I'm okay. And the point where I'm unable to address my um desires, like my lustful desires. I want to do it, like definitely I want to do it. Between these two, what I mean, the distance between this point and this point, what's actually happening here? Because I think it puts a different perspective to the whole thing.
Okay. So desires, right?
Okay,
Desire, sex drive. We all have it, right?
okay,
So it's not like the behavior in of itself. Of course, there are some behaviors that are wrong, right?
okay.
If you're addicted to stealing, just the act of stealing, even if you are stealing one, it's wrong, right?
It's
You cannot
wrong.
say I
Yeah.
have the desire to steal. So,
Okay.
right. But we all have a desire, right? We all have bodies. We all have reproductive organs. We all have genitalia. We all have these things, and so we are going to have the desires. Of course, there are some people who would say they are asexual. They don't get that desire, that
Okay.
stuff, right?
All
And
right.
so the other thing is, are you able to control it, right?
Mhm.
And so then that's when we come to it, there are some people that could be like, yeah, I have the desire, and my partner is not in the mood. So okay, that's
Mhm.
fine. I'll be okay, right?
Okay.
Versus maybe somebody that's like, oh, I have the desire, my partner is not in the mood, but let me call somebody, let me go pay somebody to do it because I have to
Oh.
do it.
Oh. Okay.
I don't care about the consequences.
I
I don't
just
care
have to.
about, yes, I don't care about who it's going to hurt, how I'm going to get it. I have to get it. I feel like I don't have control over it. If I don't get it, I cannot function or something is missing. Amen.
Oh, I think that's that. I think the way you've stated it makes me feel that's very dangerous.
What is what?
I mean, the second part where I have to get it, irrespective of the consequences. It's like
Yes. So
whatever you need to do to get it.
yeah.
Yeah.
Mhm. Yeah. So that's what addiction is, and that's what people do to get the thing that they are addicted to, right? We talk about if it's alcohol, I have to get it, right? We talked about in America, we had the opioid crisis. People were
Yes.
racing to pharmacies
I
to get
wanted
it,
to ask you about that. Yeah.
right?
It's
So,
it's it's one of my questions for you.
yeah.
As in, during that period, what actually happened with the addiction, with the opioid and stuff like that? Because during the World War II, okay, I'm just bringing a little bit of perspective into this. During the World War II, they had a lot of soldiers, these American soldiers who they were on a lot of opioids,
Yes.
morphine and etc., which were very, I mean, high. But the difference between they weren't addicted when they got back, because I learned a researcher followed them all the way through to the end, and then they realized that no, that wasn't addiction. They were taking it for the purpose of what they were doing, the pain and etc. they were doing. But after that, they weren't addicted to the medications, right? But in the same situation there is someone who is on, let's say, different forms of addictive medications. Okay, they are smoking it, they are injecting it, they are doing numerous things to it, and then yet still they tend to get addicted to. But the difference between these two people were the willpower, just as you were talking about the desire, the willpower to actually refrain from the addictive behavior was what separated these two people. How did America deal with this opioid addiction and stuff like that?
I mean, we are still dealing with it. People
Still
that,
dealing with it.
yes, the pharmaceutical companies, they were
Yeah.
sued. Um, a whole towns have been
Mhm.
destroyed as well, right? And so also the substances that we are talking about, oxycodone and those kind of things,
Yeah.
they realize that it's very strong, and these are substances that were actually made for cancer patients, but then
Yeah.
um, doctors were prescribing it to people, and they were not even, sometimes you give the person medication, you may start them from a small dose, and
Yeah.
then you see how they will react to it, but they were just
Yeah.
giving it to people, just like that, right? Just
Uh,
prescribing it anyway without actually asking. And also, in the beginning, the pharmaceutical companies didn't say that it could be addictive. So they didn't disclose that to the doctors who were first prescribing it.
so we were also prescribing out of, let's say, we didn't know, negligence or ignorance or. All right. All right. All right. All right. Huh. Addiction is really a big thing that we need to deal with. So, going further, I want to know what assessment tools, or let me say, methods do you use in diagnosing someone with addiction, especially my this masturbation issue. What are you
Yeah.
going to do to detect? Yeah.
For masturbation, I don't know if there are specific tools. I know for alcohol and other
Okay.
things.
I think we
We have
can use the same thing because it's
the
addiction.
craft.
Yeah.
Yeah, we have the craft. We have other assessments that
Okay.
people go through, and also
Mhm.
self-reported. You would ask a question. So if you're talking about specifically maybe masturbation, right?
Mhm.
Sometimes it be self-report, right? And also if the person doesn't tell you, you wouldn't know. So unless the person comes in and they're like, okay, this is what's going on, this is how it's affecting me, then you may ask them maybe how many times are you doing it in a day? How often are you doing it? In what situations are you doing it? Do you feel like you can control it, or do you feel like you cannot control it as well? And
Okay.
so it's more like asking the person and then helping the person.
Okay.
Um, I know you're talking about the assessment, but especially so we don't treat all addictions as the same, right? So
It depends on the patient, right?
yeah, the patients and also
Patient
the
base.
substance. So
Okay, and the
alcohol,
substance. Okay.
yeah. So if you're talking about alcohol, we will not treat. If somebody wants to stop alcohol, it will not be the same as somebody who wants to stop masturbation, right? So if let's say you've been drinking every day, all the time, and you're like, I'm going to stop, the first thing is we will send you to the hospital or to detox for you to go and stop before even coming to therapy. Okay, so that would be the first thing. Versus maybe masturbation, really helping the person because it's more behavior activation, helping the person to find other ways, right? Helping them to build some sort of self-discipline, little by
Okay.
little. Okay,
Okay.
are there
Okay.
any other ways that you could get pleasure? Are there any other things that you could do in terms of doing this? What are some of the things? So helping them little by little, to develop other behaviors or to think about what even led them to that in the first place. So each
Oh,
person is going to.
So it's the treatment or the assessment plan is actually individualized so that it can fit the person, right? Okay, so how do I state this? To evaluate, actually, how do you tell the severity of someone's addiction? Like, oh no, you've gotten to this level that we can't do anything about it. I once remember I had a friend who, I think senior high school, he just started smoking and doing, let's say smoking, and then we were all like, oh, you did, we have these pigeon words that we usually use, like the like your techie, it's like this whole thing is your techie now, so whatever you do you are stuck to it. Okay,
Okay.
so this person liked doing it every now and then. Every now and
Yeah.
then they tend to do the form of addiction that they are stuck with. Now at this point, what how do you determine if this is the severity form? I mean, this form the person is having is like, you are here, you can't, whatever we do to you, you can't calm down, and this type of addiction is actually here where you can massage it, deal with it, and let the person get to know how to treat them even.
Yeah.
Yeah.
So, and again, each person, right? It's different, right? So
Yeah.
treatment is like when we talk about treatment, there are so many different treatment, right? I think the one that people can you see me? I think
Yeah, I think,
the sun is setting, so it's if you could give me a moment.
United States of America. Awkward time for sun to set. Okay, so yeah,
I think this should be still, but oh,
I still get the stripes of whether they
yeah.
are, yeah, the louvers and all that, like on your face. Oh, that's perfect. This is perfect.
Okay.
Yeah, this is perfect.
Let's see. Hopefully you can.
Oh yeah, I love it. I love it. I love it. Yeah.
Okay. So we have different kinds of treatment. I think the
Okay.
one that people know the most is abstinence, right? That you abstain. But
Of course, I'll tell everyone to abstain because God, like, it's so
I'm
difficult.
not talking about if you haven't gotten into it, it's good
Yeah.
to abstain. But
Please, if you've not gotten into it, don't start. I can't. Don't start
yeah,
it.
yeah. So if you
Don't start
haven't
it.
gotten into it, don't
Uh-huh.
start, right?
Okay.
So of course, if you have gotten into it, there are abstinence programs, there are harm reduction programs,
Okay.
right? So harm reduction, the goal is to reduce the harm, right? And so sometimes the things that maybe harm
Your volume
reduction.
has your volume has, gone down a bit.
Oh, it has. Can you hear
Yeah.
me?
Yeah, I can hear you. It just
Can
went
you hear
down a
me?
bit. Yeah.
Okay. So with harm reduction, sometimes all the things that they may do, people may not agree with it because it touches on moral. So it
Okay.
could be like if somebody's using syringes to use,
Uh-huh.
that program could give them clean syringes because we
Okay.
know that if they are using dirty syringes, the rate of infections,
Yes.
HIV,
So
hepatitis,
yeah, let me just say something about that. I think in the UK there is this program we call the needle exchange program,
yeah,
right? Yeah, whereby you can actually advocate that they even come to the facility. So, I,
yeah,
I think just to top up with what you are saying, you see, in Portugal, I think my lips, I want to say this thing, I want to say it. So let me just say it. Yeah, so
go
in
ahead, go
Portugal,
ahead.
yeah, let me go ahead. Yeah, in Portugal, I think
Yeah,
they said some few years ago they had this crisis of addiction, which was there, and a lot of people, were addicted to it. But when you are caught, most often when you are caught about using drugs and stuff like this, what happens is they imprison you, they put you to certain forms of punishment and stuff like that. So over a period they had this they got in touch with a researcher who actually went through the country's, portfolios and everything. They came, and he came out to say that they should stop doing not showing love to people who are addicted to substances or whatever kind of.
I think is that the connection that where I think he was saying the cure to addiction is connection or something.
Exact. Yes, it's connection. So later on when they got, so I think you know about this. Well, for the purpose of our
Yeah.
viewers and all that, let's. So because of that, he came out and then proposed some forms of, get programs. If someone is addicted into this or that, I think you can put them into certain programs. There is something to look out for. There's family to go back to. There is some friends around you need to cherish better than just what the substance you are taking in, which is actually causing harm to you, or even the masturbation you are enjoying. You feel that is all that you need, when there is actually a human touch that can actually make you feel more comfortable. So after they did that, they realized people found purpose in life. They felt like, but I think the problem after COVID, I keep on saying post COVID, is because I think post COVID, we don't show the human nomenclature of us. We've lost connection. We are not together anymore. We don't we You sit on the bus and everyone, I bought a headphone recently because no one is willing to talk to you and all of that. So I just got a headphone, a very big one like this, so that I can cover my whole face. So yeah, I mean that's very true. When it comes to assessing and trying to find out some of the management, I just wanted to add that to it. Yeah, yeah,
Okay. Okay.
yeah. You
Yeah,
can go
so
on.
we have that program, right?
All
We
right.
have the needles exchange, harm reduction programs. There are some, in America, in I think New York and California, there are
Okay.
actually clinics that you can go in there to use substances,
Ah,
right? And
that,
there are
that's
doctors and nurses
that's nice.
available.
What about the masturbation? Are there places you can go and masturbate?
No, 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 right? And like I said, some addictions are taken more serious than
More serious than the
others.
others. Yeah, yeah,
Like
yeah, yeah.
masturbation, of course, you can go to therapy and get help, those kind of
Okay.
things. We have the methadone clinics because,
Okay.
also opioid addiction can be very drastic. It's not something that you can just stop. So,
Okay.
in exchange for the opioid, some people go for methadone or Suboxone or those kind of things as well. So there are so many different programs that abstinence isn't
The
it's not a one
perfect.
size
It's not
it's
one
not a one
sided.
size fits
Yeah.
all. Each
Okay.
person is going to look different, right? And
All
so
right.
again, the goal always is to make sure people are safe, right?
Of
So
course, yeah, the patient
yeah,
safety and all that.
yes,
Wow. I
safety.
mean, it's interesting anyway. It's interesting. Addiction has a different way of getting to all of us. Probably someone listening will be like, we've mentioned a lot of things. They are not addicted. Please, we mentioned shopping. Shopping. I won't even talk about mobile phone. We mentioned shopping.
Oh
People are
yeah,
addicted.
our
Yeah.
phone,
Yeah, we are
social
addicted.
media,
Yeah. I think almost everyone.
the
Yeah.
likes, the validation,
Yeah. Oh,
yeah.
talk about it. The likes and validation. It looks like the number of likes and the number of comments that come under people's, posts and stuff actually derails them or make them perform in certain ways just to suit these kind of things. And these are all addictions, right? These are all addictions. Okay. Okay, so let me just, I think we are far behind time. Let's see if we can deal with just a few more. What role do co-occurring mental health disorders play in addiction treatment? Yeah.
Yeah, so I think one thing there's a lot of studies between trauma and
Trauma,
addiction.
okay. In
Yes,
addiction.
especially maybe alcohol, substances, right? That There are times that people may use, when a trauma happens and they can't deal with it, they may use substances to,
Yeah.
cope with the trauma. And
Okay.
then there is also, there is substance-induced bipolar, right?
Okay.
There can be substance-induced bipolar, substance-induced psychosis, and so
Okay.
there may be hallucination and, substance use together, but it was induced by the substance.
The
And
substance.
yeah, and then there is depression, and sometimes it's difficult to think, okay, is it the depression that is causing the substance use, or is it the substance use that is causing the depression?
I will bring
It's
you here. I will bring you here. Sorry for cutting. I will bring you here to come and actually deal with depression because me, I'm tired. Oh, I'm tired. I can't talk about depression anymore because I think it's a whole like there's a whole book on depression and there are minor things that are actually leading to this depressive
yeah,
attitudes and depression stuff. Like I'll go back to say post COVID depression is now worse. Yes, I think everyone
it
can. Yeah, everyone can blame me for saying post COVID, but post COVID, guys, life is not the same anymore. Life is not the same.
it's
Like,
not right. It's not,
why?
and it's
Why?
going to it's going to. I mean, with the depression, I think the other thing that people alcohol is a depressant, right?
Yeah,
And I think people don't think about it in that way that, let me drink my problems away, but after the alcohol you're going to get depressed, right?
the problem is still there.
Coffee can
Okay.
induce anxiety, right? And
Yeah.
stress. And so you, again, we like I said in the beginning, we are chemicals, and so
Yeah.
even sometimes the food that we eat, right?
Hmm.
There may be some chemicals in the food that we eat that can cause anxiety for people, cause depression for people, those kind of things. So there are so many things that can be substance induced, right? And
Okay.
when it comes to bipolar, sometimes it's difficult, right? Is it, especially if we are talking about manic episode, was the manic episode because the person was using substances, or is it because during their manic episode and they are using, right? So it becomes
Okay.
a bit tricky. So it's there. The two can really go
Hand in
hand in hand.
hand. All
If
right.
somebody have anxiety, they may say, and public speaking gives them anxiety, they would say, oh, let me drink,
Okay.
so that I will have the energy to talk to people and to be social. However, after you drink, you can crash, as well. So it's difficult to.
Guys, forgive me because I think I'm just angry about COVID. I'm just angry about COVID. But just forgive me, yeah. So Alice, you are a psychologist, and very soon,
I'm a
just
mental
in
health counselor.
a mental health counselor, sorry, and very soon you'll be a doctor of the profession, and yeah, whilst we are waiting for something powerful like that, I think I'll put some of the questions down. I won't hit on them to now. Okay,
Okay.
I'll just wait and then see if not see if when you are done, yes, because I want to be like I have Dr. Alice, you know that kind of feeling, right?
Hopefully next week by this time.
Oh god, we are getting ready for you. We are getting ready. I have about 15 questions, okay, and we will deal with that, but for now, tell me, the person who sent me the message when I posted is
Okay.
like I'm suffering from let me read. I'm suffering from masturbation. I have been masturbating for over 15 years of my life, and I sometimes don't have feelings for my partner. Can you tell me how to refrain from masturbation?
Okay.
Oh,
Well,
I feel this pain. Oh my god.
I can tell
Okay.
you,
All right.
not on this. It's not going to work, right? I can say
Okay.
so many things. It's not going to work. So
All
I
right.
think the best thing is for the person to form a relationship with a mental
Uh-huh.
health professional, right?
Okay.
You form a relationship, you talk to them, and then they can create an individualized plan. We call it treatment plan for you so that they can take you through it little by little. Because if you have been doing something for 15 years, it's not going to be like a light switch that you are just going to switch off. And
Okay.
because I'm sure if it was all about willpower and just
Okay.
stopping, that person would have stopped already. So in the meantime, I would say really, really, have compassion for yourself,
Okay.
right? I think that's what I really tell people to have. If you're dealing with addiction, have compassion for yourself. Because
All
if
right.
you're being negative towards yourself, if you're being self-judgmental, it is going to further drive you into the addiction because it's the
Okay.
addiction that gives you comfort. So if you're
Mhm.
already feeling bad about yourself, you are seeking comfort. So you're going to go to that thing that gives you comfort. Then after which you're going to feel bad. Then it becomes like a cycle that repeats
Cycle.
yeah, over and over again. So really, really be gentle on yourself. Be kind to yourself. Now, if your partner is somebody that you can talk to them, right? We
Okay.
know that addiction thrives in silence and secrecy.
Yeah.
Once you're
Yeah.
able to open the veil and tell somebody about it, it no longer, in a way, has power over you.
Over
It
you.
loses some of its power. Now you have somebody, if it's somebody, like I'm sure if it's your partner and it's your wife, then it's somebody that you trust, somebody that you can be vulnerable with, and to tell them, hey, babe, this is what I'm struggling with, and I need help.
Hey, babe.
You don't have
Hey, babe. Hey, babe. Babe, please. That's going to be the audio I'm going to send. Hey, babe. Can you? Yeah, I'm going to record your voice. Okay. So it's going to be
okay.
like, hey, babe. What are you going to add? I mean, oh, I don't have a phone because I'm using the other one for. So you say it. I'm going to record this part and then send it. So let's go. Hey, babe. Let's go.
So I said, hey, babe.
Uh huh.
I'm struggling with masturbation, and maybe I've been struggling for 15 years and I really want to stop, but I'm
Okay.
finding it difficult to stop, and I
Hmm.
need your support in this moment. I need you to help me.
Did you just melt me? Did you just melt me? Like, ah.
No, because if it's your word, then it's okay to be vulnerable,
Yeah,
right? It's okay
that's right.
to let them know, and maybe they don't have the answers, but then
Yeah,
even if it's her sitting down with you to say, hey, let's look at some mental health professionals together, or I am
yeah,
not ashamed of you, or we will figure this out together,
yeah,
right? It's okay. You are still my husband. I still see you as the man that you are. You are not less than. That in of itself can lift your spirit, a
yeah.
little bit.
That's very true. So, in other words, whoever is, let's say, family, relatives, friends, who get to know of other people or their friends or colleagues or partners, addictions, you are not supposed to be judgmental over it. You need to help them in order to reach what they need to, right?
Yeah. Yes.
Okay.
So again, we want to be compassionate. We want to be kind, but we also
Compassionate.
don't want to be.
That's the
We
word.
also don't want to be enablers, right?
Okay.
So you want to toe the line. You don't. You also don't want to be an enabler where you are
Enabler.
enabling the behaviors.
Okay.
But if I am opening up to you for the first time and you shame me, again, you are going to push me further into
Mm-hmm.
what gives me comfort, into what I
Okay.
find solace in, right? Versus if
Okay.
I open up to you and
Mm-hmm.
even if you don't understand and your response is, okay, I'm here for you,
Oosh. Yeah.
right? Oh, okay, you could say, listen, I don't even, you are the first person that's telling me about addiction, and because
Mm-hmm.
you have told me, I'm
Mm-hmm.
going to learn more about it,
Ooh.
right? Oh,
Okay.
okay, I don't understand this, right? So I hear you.
Wa- Walk me through it.
Yeah, walk me through, or
Yeah.
give me a day or two to process it
The
for
process.
myself,
Okay. Okay.
and I'll come back to you.
All right.
Right?
Oh, this
But
this has been so. I mean, so educational. It's been educative. It's been educational. It's been educative. So I mean, all these things that you've told us. I mean, are you open for consults and stuff like that?
Um,
Okay.
on all my social media platforms, if you go, my
I
emails, my
will.
links are there.
Yeah, I will put them in the description,
Yeah,
all right, so that when people want to actually get in touch with you, they can actually do that because addiction is actually taking the youthful. I didn't mention the
the range.
epidemiology. I'm going to put it when I'm typing, yeah,
Okay,
because we've gone past that. So
that time.
uh,
Yeah. Okay.
you've actually enlightened us, especially you were able to touch on the masturbation part, and that audio I'll be sending it. Maybe I'll send you the outcome when the person receives it. And yeah,
Okay.
because
Okay.
yeah, maybe I'll send you the outcome if they are able to go through that, and then it comes out well. I'll let you know. I
Yeah.
mean, therapy is always a two-sided thing. The therapist gives you their information, the bit of things, the knowledge they want you to absorb, and then you also
And
come
you
out and then
implement it. Yeah.
exactly. So um Alice, I'm so grateful to have you here.
Thank you
um
for having me.
Thank you. And guys, if you've not subscribed to this channel, kindly take a second, subscribe to this channel. It's always a robust lifestyle with Dr. Samuel Ologo. Thank you. All right.